Greetings, I'm Dr. Jeffrey Gubbels, Market Medical Director for Sanitas Medical Centers. I wanted to chat with you today about the importance of protecting yourself as the Delta variant of COVID-19 spreads around the world. There's good evidence that in those countries around the world that had strict masking, transmission rates have been much lower, hospitalization rates are lower, and people can protect themselves with masking. We've learned in the past year, with multiple research studies around the United States, that those counties that had stricter masking mandates, those cities that maintained masking rates better than 75% of the population, saw a much slower spread of the infection. They saw fewer patients coming to the emergency rooms and to urgent cares, and they saw a significantly lower number of patients admitted to the ICU in respiratory distress. There's been a tremendous amount of misinformation about mask wearing. It's become an issue for groups that have an agenda outside of public health. But we want to reassure you that it is important that you choose to mask, that you use a good mask. Cloth masks provide little protection. A good surgical quality mask provides better protection. And the N95 type mask gives you the best personal protection possible against the spread of COVID-19. The mask prevents people who are infected from transmitting the virus by reducing the number of fluid particles that they expel into the air that can carry the virus from person to person. It's important that everyone mask because many people are asymptomatic and can spread the virus quickly without even being aware that they themselves are infected. The Delta variant is clearly much more infectious. It spreads much more easily from person to person than the earlier varieties of COVID-19 that we saw in this country. There are many non-pharmacologic measures that you can take to help prevent the spread of COVID-19. First and foremost, as I said, is consistent masking. Wear your mask correctly, and wear your mask at all possible opportunities. It's important to increase ventilation in closed spaces. It's important that building managers increase the fresh air turnover, that they provide fresh air intake if at all possible, and it's important in your home, if there's a large number of people, that you provide adequate ventilation. Physical distancing is still very important, and it reduces the probability that water droplets one person breathes out can be breathed in by another person, and this is why social distancing is still very much encouraged. Avoiding crowds makes good sense. The greater number of people combined to a small space, the greater the likelihood that one of those people may be asymptomatically infected and begin to spread that virus throughout the crowd. With this COVID-19 Delta variant, it's clear that this virus will spread much more rapidly in the past, and so avoiding these crowds, and if you must be in that situation, wearing the best possible mask is a way to protect yourself. If at all possible, though, try to avoid unnecessary contacts. It's not time for us to all shelter in place in our homes, but certainly think about if this trip is worth it and what am I going to gain versus what are the risks that I could become infected. We continue to support and have good evidence that hand washing and good hand hygiene is an important way to protect yourself. Avoid touching your eyes unless you've immediately washed your hands, and avoid situations where you may get contamination into the eyes. Cleaning and disinfecting the environment and all surfaces around you, if at all possible, will continue to help protect you. And finally, one of the most important things you can do is if you feel sick, if you have a fever, if you suspect that you may have COVID-19, stay at home. Reduce the number of contacts and reduce the spread of this virus. If you experience serious symptoms, shortness of breath, certainly seek care at an urgent care center or one of our many clinics in your market. But if at all possible, stay home with symptoms, following the CDC recommendations for isolation until you know that there's no probability that you could spread this virus to others. So that's why we suggest you remember the 3 W's. Wear your mask whenever possible, watch your distance from those around you, and wash your hands. And especially consider washing your hands if you've been touching doorknobs, door handles, or surfaces that could have been contaminated by others. It's important to remember to avoid the 3 C's. Try to stay away from closed spaces, confined spaces, and crowded areas. This is no time to be going to large music festivals. This is no time to be going to large sporting events, if at all possible. We encourage everyone to continue to watch the news. If you've not yet been vaccinated, we encourage you to do so at your earliest opportunity. We're still uncertain about the recommendations for boosters, but we certainly will make that information available on our Sanitas websites as soon as it is available. Please stay safe and know that we are with you through this journey until the pandemic is behind you. Your health is important to us at Sanitas Medical Center. Good day.